So many people wants to know what exactly is frozen shoulder or rotator cuff tear. So can you comment on that, doctor? What exactly is this? What is the
Yeah, these are two
treatment for
different
that?
problems actually, and these are the most common problems which we see in elderly people affecting the shoulder. So the frozen shoulder means the patients will have very stiff shoulder. They'll have difficulty in lifting the shoulder beyond the range of movement. So this is very common in elderly patients with diabetes or hypothyroidism, and these patients will initially start with a pain in the shoulder. They'll have movements, but they'll be painful. But gradually, after a few months, it'll become very stiff. The shoulder will become very stiff, but the pain will be very severe, and they'll have difficulty in doing every day-to-day activities. Night pains, they'll have pain while sleeping. So a lot of problems will be there, and this stage will continue for another 3 to 4 months again. And after this, the pain will gradually come down, but the shoulder will be very stiff. They will not have any movement in the shoulder. They'll have very much difficulty in doing the day-to-day activities, especially rotations. So there'll be difficulty in wearing the dress and combing the hair, like taking care of the personal hygiene. Everything will be difficult in that situation. That will also again last for a few months, 4 to 8 months it will last. And then some patients will recover after that with adequate physiotherapy and exercises to regain their motion. But that depends. As such, this process will take at least 1 to 1.5 years. So the patients will be having problems for quite a long period of time. That is what happens in a frozen shoulder. Other than frozen shoulder, the next problem which we commonly face in the shoulder is a rotator cuff tear. The rotator cuff means it is a muscle or tendon which helps to lift the shoulder. So what happens in the elderly age group is that when they age, the tendons and the muscles become weaker, and there is high chance that it gets torn even with a trivial trauma, or if they lift a heavy weight, that can get torn. So what happens is, because of the muscle tear, they'll have all sorts of problems like pain the night. They'll have difficulty in lifting the shoulder. Their day-to-day activities are affected. So these problems are very common with rotator cuff tears, and it is one of the common problems which patients present to your OPD. So again, we'll clinically evaluate them and then identify what is the problem, and then we'll diagnose the cuff tear with help of some investigations like an ultrasound scan or a MRI scan, and then proceed with the treatment.